introducing Dr. Shanelle James, who's a native Washingtonian, and she's a licensed physical therapist and owner of LimbsNThings. Her quest to become a physical therapist began in elementary school when she observed her father go from injured to well following physical therapy treatments. And since then, she's been on a quest to become a doctor of physical therapy. She graduated from Benjamin Banneker Academic High School, and she went on to attend one of the few HBCUs offering the Doctorate of Physical Therapy, Alabama State University. Since then, she's completed a physical therapy program at ASU, completed her internship in recreational therapy at the Warm Springs Rehab Center in Warm Springs, Georgia. She treated people diagnosed with acute traumatic brain injury, stroke, amputations, blindness, and various adaptive sports programs, aquatics, and more to improve quality of life. She earned her certified therapeutic recreational specialist certification while matriculating through her first year of ASU's DPT program. She has varied experiences in Oklahoma, DC, Ohio, Georgia, and she's now licensed in Washington, Maryland, and Virginia, and has worked in skilled nursing, outpatient facilities, and early interventions in DC, as well as home health, house calls, and inpatient rehab. And with that, I'll pass the mic over to Dr. James.
Good morning, everybody.
Morning.
All right, is everybody able to see my screen?
Yes.
Yes.
Oh, great. All right, so this morning we're talking about, is it aging or inactivity? And as Ms. Aaron introduced, my name is Dr. Shanelle James. I'm the owner of LimbsNThings mobile and telehealth practice. So let's talk about it. The first statement, nothing says I'm aging gracefully like what? How would you complete this? You can type it in the chat or you can say it aloud. I'll give you a few moments. Nothing says I'm aging gracefully like, how would you complete this statement?
You can get up without aches and pains.
Okay. Anybody else?
You can get up, period.
Being able to pick things up off the floor without deciding what else you can do while you're down there.
All right. I like that answer.
Yeah.
So I said tone, muscles, and skin because we tend to think of being youthful as having tone muscles and tone skin. How would you complete this statement? Nothing says I'm getting older like.
I like your answer.
Yeah.
Except the women especially get to cheat a little.
That's true.
Or the cracks and pops that your body makes when you get out of bed.
Okay, that's a good one. Okay, nothing says I'm sedentary like. How would you complete that one?
Having trouble going up and down the stairs in the morning, first thing.
So the stiffness that comes early in the morning, huh?
Yeah.
Okay, anybody else? Nothing says I'm sedentary like.
Going straight to the sofa after dinner.
That could be your full though, right? So I said, let's see. Being out of breath with little activity.
Okay, that's a good one. Very good one.
So let's talk inactivity. It's really the reluctance to take action. And then aging is the process of growing old. Those are like the simplest definitions. So let's talk about a few of these things. Weakness, loss of balance, pain, and joint stiffness. Those four, is that inactivity or is that aging? Weakness.
Inactivity.
Inactivity.
Very good.
Yeah.
All right, and then hearing loss, reduced eyesight, stiff blood vessels, and drier skin. Aging or inactivity?
Aging.
Aging.
Very good. Okay, so let's talk pain and joint stiffness. Yes, those are signs of inactivity. And as someone mentioned, stiff joints, that kind of happens when we've not been moving as much. Those things beget pain. And of course, pain causes you to have some moving issues when you're doing familiar positions. If you have not been flexible or you're just experiencing that stiffness. So stiffness begets pain on movement. And then, of course, that's usually when we're sitting more throughout the day. But the real issue that we want to have is that your joints need lubrication. So if you're not moving and moving your arms and your shoulders, the joints don't get that lubrication. And really that's due to inactivity, not getting older. Okay, hearing loss and reduced eyesight. My grandmother, she lived in a house where there was a long sidewalk. And as I would get to half of the sidewalk, I could always hear her TV. To me, that was a sign that she was getting older because her hearing was diminishing because the TV was already turned up very loudly that you could hear it before you approached her house. Some of us, as we get older, require reading glasses to see finer print. And then that is due to having reduced blood flow in the area of your optic canal as well as your ear canal. Weakness and loss of balance. These are things we already talked about as inactivity, but how could we combat it? We need our muscles to pull on the bone, but only with demand. So if you're sitting and you're not standing often throughout the day, then your legs are going to have flabby muscles around them because you're not getting the demand of the weight of your body on them on a regular basis. A way to combat this loss of balance is challenging your balance. If you were to stand and close your eyes, would you be like a mannequin or would you sway if the wind blew? You want to make sure that every time you are challenging your balance throughout the day. And because we use our vision so much to maintain our balance, closing your eyes is the best way to assess how your balance is doing. And then as I spoke about earlier, bearing weight to increase the strength of your arms and legs is so important. So doing push-ups, even if you're unable to do them on the floor now, you can do them against the wall, on a raised surface like a chair that's stationary and pushed up against the wall so you're safe. All of those things are important to maintain not only your core strength, because you get that with the push-ups, but also your arm strength and your leg strength from standing throughout the day. So let's talk dry skin and stiff blood vessels. Is there anyone like me who likes a hot shower? Yes. But as we get older, we really should decrease the water temperature because that improves the moisture retention of our bodies. So a lot of my patients tend to say, I take showers maybe twice a week, maybe 3 times a week, but they're spacing out that time that they're under a higher temperature of water so that they're trying to maintain the pliability as well as the moisture in their skin. You can do this also with movement because it lubricates you from the inside out. And then stiff blood vessels. We call this an aging sensor called baroreceptors, where as you are getting older, those sensors tend to adjust to the point that sometimes you can't get up as fast. You'll have a dizzy spell if you stand too quickly. That's referred to autonomic hypotension, where your blood pressure drops if you stand up too quickly and you have a dizzy spell. And we know that it's so important that we don't fall because that just leads to a sequel of having problems of being in and out of the hospital, which we refer to as the revolving door syndrome. So a way to reduce these stiff blood vessels is flexibility and regular movement. So what can we do about inactivity? These are my little people, but we can walk, we can work in our yard, and we can stand. So walking, we don't want to do a walk on Friday and then do another walk on the next Friday. You want to make sure that you're doing it throughout the week. And it's recommended that you do 30 minutes a day. You don't have to do that all at one time. You can break it up, especially if you're at the computer a lot of your day. You want to make sure that you're giving yourself time to stand up, to stretch, and to make sure that that blood circulation is constantly moving throughout the day. Working in your yard is good for not only your physical health, but your mental and emotional health as well. And then standing helps to improve the weight bearing and strength of your muscles, as well as your balance and control.
Another thing you can do is get a puppy.
Oh, for sure. I'm going to talk about that real soon.
Okay,
So
sorry.
what can we do about aging? I find that a lot of people, when they go from working to retiring, they just don't have a plan for moving on a regular basis. So that's one thing that I think is really important, that you don't retire and have no plan for moving on a regular basis. And then engaging in some fun activity, but with an accountability partner. We tend to do better when we have to tell somebody, I'm going to do this, and they hold you to the task that you said you're going to do. And then, as you mentioned, spending time with your pet or your younger family members, they tend to keep us active, more active than it would be if we did not have them. And then you just got to refuse to be inactive, right? You want to challenge yourself to do an activity on a regular basis so that your muscles and your joints, your tendons, your cardiovascular system, your total health will be in its best shape as you age. And then, of course, if you're noticing difficulty with staying active, you can see a physical therapist. And then for me, maintaining a close relationship with God is important too. So when should you see a physical therapist for inactivity? There are really three main times: when moving hurts, when you want to move better, and if you've had a change in your functional status. That sounds like all the time, doesn't it? So let's see. What do physical therapists do? We analyze what you say, how you say it, and how you move to determine the cause of the movement challenge you're experiencing. We address movement challenges by prescribing exercise, assistive devices, modalities such as electrical stimulation or ultrasound, and position adjustments, much not like a chiropractor where it's more of the axial skeleton or your spine only. We look at and do mobilizations and joint mobs and manipulations on all of your joints. And then postural corrections, trying to help you not lean to the side when you're walking, maintaining your balance so that your core is strengthened when you're standing or walking. And then a lot of us are referred to as the walking therapists. So we definitely analyze how you walk. And it tells us so much about how you're doing with your stability, your muscle strength, and we can usually tell where the pain is in your body just by looking at you walk. Okay, so there are 5 major systems that we treat as physical therapists. And the first is the integumentary system. Wounds, scars, looking at your skin integrity in that role of movement. So if we think of someone who's had a joint replacement or someone who's had an amputation, we have to check the healing of the wound to make sure that it's not opening, that there's no infection there, and that the person is safe to bear weight on that limb, or that they're safe to move it in a way that they won't cause the wound to open. With your musculoskeletal system, as I've talked about, a lot of people tend to know this already, but joint replacements, if you've had any pain in a certain area, amputations, those are the areas that we work with the musculoskeletal system. And then neuromuscular, those who are post-stroke, post-brain injuries, multiple sclerosis, Guillain-Barré, there are a ton of different diagnoses in that area, but helping someone to increase the ability of those nerves to send the correct signal to the muscle for it to move. And then the cardiopulmonary system, especially with COVID-19 and pneumonia as well in this season, returning people to function with endurance training, trying to help you to improve your lung function so that you can do the activities that you want to do. And then the cardiovascular system, with people who've had a heart attack or vascular surgery, we're looking to increase your ability to maintain a steady heart rate while you're doing a strenuous activity. Because the heart is a muscle, we want to train it to accept the demand that you would place on it. And so in these 5 major systems, our goal is to rehabilitate, to maintain, or to prevent movement dysfunction. And that's the whole scope of practice of a physical therapist. All right, let's see. So again, my name is Dr. Shanelle James. I'm the owner of LimbsNThings, and I treat aging adults in DC and Maryland and Virginia. And I help you move from I can't do something to I can. These are the ways you can contact me through my phone number, email, social media, as well as the website. I am in network with Medicare B and TRICARE, and I accept private pay as well. I want to thank you all for listening, Ms. Merrill, Ms. Sabrina, and Aaron, for all of your help, and everyone with the entire Senior Service Alliance team. If you have any questions, I'll take them. Thank you.
Dr. Shanelle, I recently had an experience with swelling in the lower legs and ankle areas. It's very gradually subsided, thank goodness. But what do you recommend to either prevent or alleviate the swelling in the lower legs?
So a good thing to do, especially without knowing if you've had any underlying conditions, having a walking program on a regular basis. And then if you're sitting at your computer, to elevate your legs. But if you are elevating your legs, you want to have it above the level of your heart. That's kind of an uncomfortable position for some people. So if you imagine yourself laying flat on your bed and having your feet up against the wall, that's the best position for them to be in, especially at the end of the day. Because when we sit in dependent positions all day, like the, let's see if I can do it with my hands, 90-90 position, like that, we tend to pull blood down in our lower limbs. And so if we elevate them throughout the day, or we're walking often, then that blood circulation is going around as it should. So at the end of the day, I'd suggest that you lay flat on your bed and have your feet up against the wall.
Sounds like I got to get up from the desk every once in a while.
Yes, yes, absolutely.
Dr. Shanelle?
Yes.
I just had a kind of a current experience. My life partner and I went on vacation, and the drive was 6.5 hours. Well, with him driving, we only stopped once after 3 hours, and then we went 3.5 hours. That's not my rule of thumb. I go every 1.5 to 2 hours. And we got out of the car on the passenger side. I pulled my right leg out, and I heard, I went, oh boy. I could barely walk, and it was coming from my hip. Now, I've been athletic all my life until I started aging. I was a tennis player, I was a racquetball player, I was a runner, you know, et cetera, et cetera. And we figured out that it's what you would call a groin injury. There's a tendon right in the edge of the leg. And my life partner was the director of the entire Army Nurse Corps. So he knows a lot about the body. And he said to me that it takes 3+ weeks for something like this to fully heal. Are there exercises that one can do to help this, or you just have to take Advil?
There are definitely exercises you can do. It's more along the stretching aspect. Just because it's an acute injury, you just want to gradually lie on your stomach and in a point that's like a snow angel, so that you are stretching out that area, but in a manner that you can tolerate.
Yeah, I've tried a few different.
It does take a while to heal, though.
I don't like that answer.
I know.
You know, sometimes I put my right leg down and I feel like it slips, you know? So I have to really be careful with possible falling again.
Yeah, sounds like you need a physical therapist.
Well, I might talk to you after.
Sure.
After we're over. This is over. Okay.
Not a problem.
Okay. Any other questions? Any other people have issues with their own physical fitness?
Is anyone else getting older?
No. So Dr. Shanelle,
I got a question.
Go ahead, Brandon.
I'm not getting older. Well, I am getting older, but I'm kind of younger than y'all. But I was just wondering, I mean, are you opposed to taking other insurances like private insurances?
No, I'm not. There just are a lot of different rules when you take different insurances. And my goal in taking Medicare and TRICARE was to increase the access for aging adults to have physical therapy. Miss Rebecca, I think you had a comment.
Yes. So I've had 2 hip replacements now. The most recent one in June, and went to physical therapy and recovered very well. So I'm really happy about that. On the other hand, and I'm a very active person, so I'm very lucky. I have a sister who is 10 years older than me, who struggles with arthritis and is very inactive. Do you have any advice about how to help her get it in the mindset to become a little more active? She doesn't walk, she doesn't do anything.
I think the best thing to do when people are a little resistant to being active is to find something they like to do. Like for me, if you tell me to go to a gym, I don't want to do that. But if you let me go to a pool and swim and we're doing it together, I'm more likely to do that because I like swimming. So if you find something that she really likes to do, and then possibly doing it with her or someone in her family, then it might make her more interested in doing it. And then she'll notice that arthritis probably decreases, and then she'll want to continue to do it.
Thank you.
No problem.
Maybe I'll get her granddaughter, who she adores, to work on her.
Absolutely.
Can I add something to that? Dr. Shanelle, I absolutely have to agree with you. My father, may he rest in peace, my parents were very athletic in their younger days. They were avid tennis players. And as my father got older, and he couldn't play tennis, but he would never do anything on his own. But if there was somebody else to do something with, whammo, he was right there doing it with him. He needed that emotional energy of having another person there. And he was physically in good shape. He died from Alzheimer's, but he was physically good shape until his 89th birthday.
Awesome.
Yeah.
So Dr. Shanelle, what do you think about the phrase, don't use it, you lose it?
I think it's true. Definitely the importance of moving helps you to not lose the muscle tone. That's what I look at. You know, if your muscles are still strong, then you won't fall. If your muscles are still strong, then your ability to go a little further, your endurance is still good. If your muscles are strong, then the likelihood of you injuring yourself is diminished. So those terms in terms of muscle strength, especially when it comes to your heart, as well as your physical function, that's where I think of the, if you, as you just stated, that statement comes even more important.
Dr. Shanelle,
Yeah.
could we discuss arthritis a little bit? Because that's something that I think is fairly common to a lot of us more experienced people. And I've always thought that it was something that is can be in your joints and inhibits movement, makes movement painful. What is arthritis, and what can you do to either avoid it or minimize its impact?
Okay, so arthritis has a couple of different types. Rheumatoid arthritis comes from rheumatic factor. That's something you really can't do anything about. That's in your DNA, right? If you're gonna have that. It usually attacks your smaller joints, so your fingers, your wrists and hand. Some people even have it in their ankles. Those areas, and what you can do about it, those tend to be better treated by a physician. We usually do a lot of water, so vascular exercise to increase the blood flow to those areas, because people tend to also have numbness when they have that. And so that just reduces that stiff blood vessel that we were talking about before. Osteoarthritis is the more common one that people have in their larger joints, and that's from overuse of those bones throughout the years. A lot of you have talked about how you've been active in sports when you were younger. And so that overuse can come from decreasing the cartilage that's between your joints. And so you just have to be sure that your shoe choice is good. A lot of times we want the cutest shoes sometimes for females, and we want shoes that don't look old for a gentleman. And so we need shoes that have a little cushion in them, because then that improves the space between the spinal cord. So all of those vertebrae that have the little cartilage in between, that decreases, kind of like with osteoporosis as you're aging. And so if you have a little lift in your shoe, not necessarily ones that we all can see, but just the shoes that have a little bit of more support at the bottom, then those will decrease how much force is going into our joints, especially the larger joints.
I've also noticed as I've gotten older that the bottom of my feet are more sensitive to hard surfaces. And I found myself reluctantly but consistently inserting either a Dr. Scholl's cushion or some other kind, or getting shoes that have more cushion and avoiding the ones that have the hard soles.
Absolutely.
I'm very glad that we're wearing a lot of tennis shoes now, because
Oh, yes.
it's much more comfortable.
Yes.
Is that just a normal part of aging? Is the reduction of the fat layer on the bottom of your feet?
It is. Yep.
Okay.
Yeah.
Good to know I'm normal.
So what do you think of the Good Feet store versus the human being determining which shoes are better for oneself? And I will tell you, I used to live for heels. The taller I was, the better I felt. Now, since I broke my ankle a year and a half ago, no more. Flats is the way I go.
Yeah.
But anyway, I'd like to hear what you have to say about the Good Feet store.
I think not necessarily the store, because I don't want to promote a particular store.
Of course.
But the stores that do the mapping of your feet to help you determine the correct shoe, I think those are great, because that helps you know specifically what areas you need to improve upon, because they let you know where you're wearing on your shoe, especially if you're more of a person that puts more weight on your big toe versus your little toe. If you're more anterior, put more weight on your toes and the back. If you have a lot of calluses on your feet, it'll show you those pressure points. So it's important to get that mapping so you can know what shoe is best. But all of the ones that have cushion help you to wear them a little longer, because that cushion is providing the back support that you really don't even realize the shoe is helping you with, as well as the feet, sole of your feet, to not feel like you're hitting hard surfaces every time you're stepping.
Well, certain people, women, I call their shoes the clapper, because they don't have a back on them, and you can always hear them clap, 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 clap. I was aware of them too, but what I noticed is that I would curl my toes to like assure that I kept them on.
Oh yeah.
And that causes problems with the toes also.
Yes, it does. Yeah. I always recommend people to have, even if you like, say, clog shoes, you want to have a heel, the little thing that covers your foot in the back, your heel of your foot. You want to make sure that's there, because it doesn't demand as much force on your toes, and you're able to walk a little bit with less attention to your feet, just because your foot is not having to demand so much from you. So shoes that are flip-flops, I don't recommend those.
Yeah. I've heard podiatrists say that if you're going to wear the clogs from Crocs, is to have the strap against the back of your foot.
Absolutely.
Yeah. Thank you.
Yeah. Dr. Shanelle, I have a question about compression socks. I had injured my left ankle many years ago, just out walking in the yard, for crying out loud. Twisted, whatever. We've got a lot of trees with nuts. I'll just leave it with that. I partially pulled my Achilles tendon. And later on, I developed fascioplantitis or fallen arches in the right foot. So if I know I'm going to have a long day out there, I do make sure I have my weighted compression socks on and the proper shoes and the orthos. My concern is that once my husband and I plan to retire in 2024, we want to get back traveling. When I'm on airplanes, especially, I've noticed that my ankles, if I'm not really careful, are going to swell up like balloons. Heck, I barely made it to Denver 5 years ago. We were on our way to Hawaii, and I thought, oh no.
Oh, yeah.
You know, it was embarrassing to have to order a wheelchair and whatnot, because I knew that once your feet got swollen to a certain point, you really shouldn't be on them.
Mhm.
So how long can you keep the heavy duty, what I call the airplane socks, on? Is there a rule of thumb?
Whoever prescribed them for you should be able to tell you a specific time. However, as a rule of thumb for me, I don't think you should wear them longer than the time you're active. So if you're up 8 hours a day, then you should wear them during that time, because the compression socks are made for your activity level. And so if you're using them and you're sitting, then you don't really need them, right?
Well, no, I do get up. Well, my hesitancy is that we would like to head back to Hawaii at some point. My husband's from India. We're talking serious time in the air sitting. You know, yeah, you might be able to switch planes at an airport and waddle around for a little bit, but the problem is that I don't have the luxury or a place that I can take the socks off. You try doing that in an airplane bathroom or.
Oh yeah, that's definitely a difficult task. I get it.
So I don't know if.
Go sit down.
When I'm doing really long trips like that, should I just keep the same socks on until I get to my final destination and just.
You should, however, you want to move as well. So you don't have to get up and walk. You can move your ankles in a circle. You can bring your legs up and down. All of those things help increase the circulation as well, especially when we're going long journeys. Those things are highly important. The movement with the compression, I think, is the piece that we don't always put together.
Yeah, because that's the only way I could get through a long day. When I was working, I'm a cognitive coach now, but when I was working in facilities, you know how it goes. You're up on your feet all day, and I love the physical therapists. There's always, sneaky little things that you can learn how to do.
Yeah.
I wish I had one with me last year when I had a frozen shoulder, my right shoulder. Oh man.
Oh yeah.
Oh, and I still don't know how I got it. I mean, and
yeah, those are what we call insidious onsets. Yeah, but they're common also in people who have diabetes, and I don't know if that's widely known.
That is an issue I'm dealing with. Both my husband and I are kind of pre-diabetic. We're bouncing along. We're both seeing an endocrinologist in the next few months just to kind of see what's going on. Been trying to get more protein, and it's funny because I didn't really think of myself as abusing, and none of us are sodas or super candy people or whatever. So I'm not sure. We're still trying to figure that out, and we are getting some help with that. But that's a good observation. And if I keep my orthos with me and just move, I found that if I just take at least 10, 15 minutes, and even while we're here, I've been just kind of bouncing my legs around, just doing some stretching. And I make sure that my students, I'm teaching the 80-hour assisted living course on the side. And so, oh yeah, they don't get out of that class without learning laughing yoga.
Like it.
Thank you, though.
No problem.
Dr. Shanelle, great presentation. Thank you.
How
And it's great. It's great to see you again.
You too.
Thank you so much. So, I think that especially when we're talking to seniors, and a lot of people have those balance issues and so on, how can we help people strengthen their core? Because I think it so much has to do with that core. How can we help people strengthen their core? Some simple movements that can help strengthen the core for all of us, really, because that'll help us with being more limber, with our balance and strength, and so on as we age properly?
Good question. I think the most important thing to do is when you have things on the floor that you reach to the side to get them, we tend to not focus on the side of our bodies or the side of our core, your oblique muscles. And so if we're reaching to get things off the floor, not necessarily bending, but actually leaning to the side to get them. Another way is doing wall push-ups. Those are really important, that you maintain your posture or your upright position, and then you're just pushing your arms back and forth. That strengthens your back, but it also strengthens your core. And another thing is how we stand. A lot of us tend to lean forward to stand up, and we should really stand like this, putting both hands on the side of the chair and pushing up while looking like an elevator. So being straight up. And those things functionally can help you.
One of the things you said, you talked about strengthening your back. People often overlook strengthening your back, because when you strengthen your back, it tightens your core. It changes your posture when your back is stronger, and it brings you more upright and so on. So that's great. I appreciate that. Those are some simple movements that we can share with both our seniors and ourselves.
Yes.
So, thank you.
Can you hear me?
Yes, ma'am.
Okay. I had back surgery about 6 years ago, and they put in a titanium thing. And I wonder, are exercises over time going to stretch that and make that worse again? Is that something I should be concerned about?
So it depends on the exercise that you're doing. It should not make it worse over time, though. No.
So when you say it depends on the exercises, what do I need to be concerned about?
So you don't want to do things that are giving you a lot of different weight. Say if you're, I don't know if you're into weightlifting, but if you're lifting weights, like a barbell or something like that.
I don't know. I should not be using weights?
Right. So it just depends on the technique you're using if you're lifting it. Right. So if you're not using weights, then that's fine. You can just use your body weight. And that shouldn't be a problem. The same exercises you were using when you were doing rehabilitation after your rod placement, those should still be fine to do. You can just increase the reps, and that will increase your strength in your back.
Okay. I have another question. Okay. I have knee issues, and because of a heart issue that I have, and my age, they're reluctant to do knee replacement. So when I live on the second floor, which I think is probably wise, actually, but when I go up and down the steps, it hurts some. Is that something I should avoid, or is that okay?
No, I don't think you should avoid the steps because it hurts. I think you should alter how you go up and down the steps. We don't have to go forward. You can go sideways, holding the rail with both hands and coming down. That should decrease some of the pressure on the front of the side of your knee. And then you can also adjust how much forward leaning you're doing when you're going down the steps, especially if you're using a rail or a cane to go down. So don't stop going down the steps.
I should not be leaning, is that what you're saying?
Right, so especially those of us who tend to pull on the railing or the grab bars, you want to just push down, and that'll keep your body upright.
Okay. Thank you.
No problem.
Any other questions? Well, Dr. Shanelle, I think you've covered the gambit.
Thank you so much for the opportunity.
This was phenomenal. It was just phenomenal. And I mean, I've opened my eyes to a few more things. And I did say goodbye to heels because I can't afford to spend 3 months sitting on a couch again, which I had to do. So, all right, let's start
I just want to say something real quick. Sorry.
Go ahead. Not a problem.
Yeah, Dr. Shanelle, I want to say this was really a great presentation. I like the down to earth, easy way you explain things and even
Thank you.
the answers to the questions. And I also wanted to point out that I like what she said when we had a one-on-one, which is that she meets you where you are. So if you have difficulties, like maybe in the grocery store, in the gym, going up and down your stairs, that's like for the seniors we serve, she's able to come there exactly where you need to be or where you're having the issue and help. So just wanted to shout that out and thank you for today.
Thank you. I appreciate that.
Yeah, can I say something?
Please go ahead.
Hi, good morning. This is Melissa. So I have to just give a testament to Dr. Shanelle James. She actually treats a lot of my clients. And, I tell you, being in the business of home care, it's extremely important, to us that our clients are thriving, using safety techniques, learning about the fall risk and what they can do, to kind of be their best at home with our help. And, we work alongside with her and it's a tremendous help. She's compassionate, she's caring, she's super knowledgeable. I mean, they really cannot get enough of her. And, I'm going to get off my soapbox, but I just want to say thank you so much. I mean, you all just don't understand. This woman really gives that, concierge one-on-one attention, and she means it. I mean, she truly signed up for a service, and I would say it is her ministry. And it's just wonderful just to watch her work. I've seen it, and it's just on a whole nother level of care. So the fact that she has all of the credentials that she has, she truly understands therapy on a whole nother level. And again, I just want to say thank you. Just from my clients to you, they truly appreciate you, Dr. James.
Thank you so much.